Okay, now coming to pediatric stroke. Yeah, so this is one of those classic spotter diagnosis, multiple collaterals in the thalamo-perforating arteries, and then the main ICAs are blocked, and that's why you have the collaterals, and the collaterals give the puff of smoke appearance. Now, moya moya would be something which even the clinician sort of suspected because there were multiple episodes of strokes. So what we are doing the MR angio for is to look for the size or the caliber of the middle cerebral artery, so that the surgeon, this is managed neurosurgically, so that the surgeon can go ahead and do a STA to MCA bypass. So superficial temporal artery to MCA bypass. So that will eliminate the need for all the small collaterals, and you will have the external carotid artery, then the superficial temporal artery going and supplying the MCA retrograde, and then that will prevent the stroke-like episodes. So we have basically the need for doing an MR angio is to look which MCA should he target. Right MCA ठीक है, तो let's do a right MCA STA bypass. Left MCA is looking better caliber, let's do a left MCA STA bypass. Okay, so now this is a young child who 15-year-old child who suddenly came with this vertigo imbalance after doing a performance in school of break dance, and then he fell and then he had this. So diagnosis, excellent. So which vertebral artery, which segment rather, can we see it over here? So we can actually, this was a stroke here. Brain angio is done. Neck angio was not done in the interest of time, and the child was not very stable. So here if you see, you can, suppose I didn't show you the source image, then there's a very high chance of not even looking at this area. So here you see there are two lumen like things. There are two flow areas which are white and seen on the source image over here. And this one is actually the intramural hematoma, the one which is lateral. Why am I seeing a hematoma on this TOF image? Because basically a TOF image is a T1 weighted image, and I'm going to see subacute blood in that. So I'm seeing flowing blood as bright because it's TOF after all, and I'm seeing subacute hematoma as bright because that's what it's supposed to look on T1. So that is the whole aim is not just to tell stroke hai, or we don't know, stroke in young, go ahead and look for all the 125 causes. Stroke in young, and you can actually give an answer. Even if you didn't have the time to do a neck angio, please look at the brain angio, whatever you have, to the best of your capability.